Good morning, everyone. My name is Annette Johns, and I'm the Associate Director of Policy and Practice with the Newfoundland and Labrador College of Social Workers. I want to begin by saying Happy Social Work Month. This year's theme, 7 Points of Unity, Many Possibilities, celebrates the release of the 2024 CSW Code of Ethics. This new code contains 7 values that guide ethical, inclusive, and empowering social practice. And the NLCSW has adopted this code for use in this province starting today. You can access the Code of Ethics and the NLCSW 2024 Standards of Practice on the NLCSW website under the Social Worker section. In celebration of Social Work Month, I'm happy to be the moderator for today's education webinar, Identifying Theories and Models in Practice. And this is certainly a great session to kick off Social Work Month celebrations. The webinar presentation will be approximately 60 minutes, followed by a question and answer period. During the presentation, I do encourage you to type in your questions using the question mark icon to the left of your screen at any time throughout the presentation, and I'll begin asking them at the end of the presentation. So I now want to introduce our speaker, Nikki Brown. While Nikki's full bio is on the webinar platform, I do want to say a few introductory remarks before I hand the virtual podium over to Nikki. I would like to say that Nikki is a registered social worker and a Master of Social Work student in her final semester. She's presently completing her MSW field placement with the field education team at Memorial School of Social Work. Nikki's employed by Memorial University and has worked for several community organizations in St. John's. And she's also a member and colleague on our NLCSW editorial committee. Nikki, I'm really looking forward to your presentation this morning, and I'm now going to turn the virtual podium over to you.
Thank you so much, Annette. I'm really happy to be here, and I want to acknowledge that everyone took the time out of their busy schedules to come and tune in today, so thank you so much for coming. As Annette mentioned, I have been doing my MSW placement with the field education team. For the first half of my placement, my field instructor was Lindsay Soper Thistle. Many of you have probably worked with Lindsay. So through discussions, we decided it would be nice to offer a continuing education session for current and future field instructors, just to kind of give you some more tools for your toolbox when it comes to supporting BSW students. So based on a poll that we administered to field instructors in the fall, this was the top topic that came out. So theories and models in practice, identifying theories, developing your knowledge around theory. So I'm really happy to be presenting this to you today. I do want to mention that the second topic in the running was supporting disabled students. That came in as a close second, and that was also amazing to see. So you will see in your sidebar, there is an option for resources, and in that resource tab, you will find some quick reference tools as well as critical reflection tools, one of which is a critical reflection discussion guide that will help you learn more about disabilities and speaking about disabilities and supporting folks. And you can use that with students, or you can use it on your own or with your colleagues. So I encourage you to check out the resource tab. So again, thank you for tuning in today. And thank you to those of you who have provided field instruction in the past or continue to do so. Some of you might be tuning in with your students right now, for those in the winter semester. And it's awesome to see so much interest in this continuing education event. So our first discussion is going to be the question of why. Why should we talk about theories, models, and methods? So the objective of this session is to enhance your ability to identify theories and models at play in your work. We know we use theories and models all the time in our practice. It's taking that step to consciously identify and to consciously reflect on how and why. So these exercises that we'll go through today will help us with that. So what are the benefits of using theories, models, and methods in an intentional way? They actually provide rationale, grounding, and guidelines for our practice. They can open up opportunities for furthering continuing education, and engaging in this learning can spark a desire to pursue further learning, and supervising BSW students can foster this as well. Many of you may already know that supporting students and engaging in field instruction can be a really reciprocal learning process, and it's so helpful to learn from students with a fresh perspective. And so being able to feel competent and ready to support students is really important. Some may not think that it's important to differentiate. You may have heard, strengths-based is not a theory, it's more of an approach. And some of you may say, oh, well, these are the things that I use and I don't really bother to differentiate. And that's okay. Everyone's different. But from my perspective, it is important to differentiate, and something that some of the models that some of these tools that we're going to talk about today have been developed by an educator and practitioner, a social work practitioner out of the UK named Siobhan McLean. And Lindsay Soperthis introduced me to her work. So I'm going to be using some of Siobhan's kind of content today to help guide our discussion. And she also believes it's important to differentiate and provide some really easy and accessible ways to do so. And part of the reason it's important to kind of advance our learning in this area is because it aligns with the value of competency from our code of ethics. And in terms of the new guidelines, you're actually bringing this value to life today as you engage in continuing professional development. Additionally, today we will include some aspects of reflection for theory in the context of your practice, thinking about why we use the theories that we use or why we don't use certain theories. And finally, in terms of the guidelines for the value of competency in the new code, in leadership roles, a good grasp on theories and models can help assist us to inform and guide the work that is completed by staff who may report to us. So it really helps us enhance our leadership as well. And finally, on the topic of supporting BSW students in their learning and field education, as I said, it can help us feel more prepared. Students ask questions, and sometimes we know the answer, sometimes we don't, and that's okay. But it can feel great to have those tools in our pockets towards supporting student learning, and again, that reciprocal nature of learning. So now we're going to do a little bit of a visual exercise. This will be our first activity. So for all of you visual learners, this little silhouette here, let's call him Gus. So Gus has some clear symbols that are going to help us remember the differences between theories, models, and methods. So as you can see, our little silhouette here, he's a little bit tiny, but you can see that he has his brain in his head and his feet are not in shoes, but his brain is for helping him understand. And so that is where theory comes in. Theories help us to understand what we're seeing. They help us make sense of what we're seeing. And this diagram here itself is something that Siobhan uses in a lot of her educational resources to help us kind of have that visual cue. So for the brain, it's how we understand, and that's theory. You can see the heart. And we'll go back to the heart, but we're going to go all the way down to the hand. And so the hand is how we begin to act or intervene, and that can be classified as a model. And we'll break this down a little bit further as we go. The tool, which we use with our hand, is the specific method that we use to intervene. So we'll talk about some examples shortly to help further this example. And the heart is our approach, or as Siobhan likes to say, the flavor of your work. So you can flavor things differently depending on your approach. So, as we said, theories help us to understand. They help us explain what is happening and why. They can also help us predict what might happen next. However, they don't tell us what to do next. That's where models and methods come in. So, for example, theories, you may use feminist theory. You may use critical race theory, social learning theory. They help us understand communities, ourselves, people's behavior, and situations. Whereas models are what we use to help us decide what to do next or what to do about this problem or this issue that we're understanding. Models guide our interventions, and methods typically lead us to what we do next. So some examples of models are narrative therapy, solution-focused therapy, crisis intervention, and harm reduction. The methods and tools are derived from models generally, and they are the specific tools we use for these interventions. So for example, you may use strengths assessments, eco maps, scaling questions, or the miracle question, for example, from solution-focused therapy, which is a model. And your approach is your overall way of working with people, policies, or situations. It often informs what you do and how you do it. You can have a blended approach, and your particular approach will flavor the model that you're using. For example, you may use a narrative approach, a strengths-based approach, or a person-centered approach. So you'll see some overlap there for sure. So you've heard me mention theories and models. Now we're just going to talk a little bit more, kind of break it down further to help us understand some of the origins of what we talk about when we talk about theories and models. Social work theory often draws upon social science theories and knowledge. We have gained so much and built a strong foundation through collaboration with other disciplines: psychology, sociology, philosophy, gender studies, just to name a few. So you'll see here in this diagram that I found on the lovely internet that there's a bit of an outline here of critical social science theories as compared with conventional social science theories. So many of you are likely familiar with some of these, and some of these may not be so familiar. So what we're going to do next is a little poll. So this poll is just to kind of get a feel for what folks are most familiar with. So if you feel comfortable, feel free to answer this poll now. Which theories do you use most often in practice? Do you use mostly critical social science theories? Do you use mostly conventional social science theories? Do you use more of a blended approach? Or are you not sure? So you can go ahead and enter your answer now, and we'll use these results as we go along in the session. All right, so we've got some results coming in, and I'm happy to be able to share them with you. So as you can see here, it looks like folks are using more of a blended approach, which is awesome. So they're taking a little bit from critical social science, a little bit from conventional social science, and some folks are not sure. So hopefully this session will provide you with a little bit more clarity on that. So a lot of you are probably familiar with, for example, developmental theories like attachment theory, behavioral, cognitive, and social learning theories, systems theories, and many of you have likely heard of feminist theories, Marxist theories, post-colonial or anti-colonial theories. Some of you may not be so familiar with other theories like critical disability studies, queer theories, MAD studies. So what we're going to do is kind of draw out some of those through our second exercise. Thank you for your participation in that poll. All right. So before I dive in, I do want to share that I emailed Siobhan to ask her permission to recreate this activity, and she was glad for me to do so and advised it is a feature on her free app, which we'll talk about a little bit later. She even offered to join in with us, so for future reference, we have an excellent social work ally across the pond in the UK. So this is called the envelope activity or envelope exercise. And I did this session with a group of 5 BSW students in the fall who were under the supervision of Amanda Devlin at Connections for Seniors. And we had a really great time that day, kind of breaking things down and trying it out for the first time. So I thought it would be helpful for us to recreate it here, as the students and Amanda provided feedback that it was helpful. So you'll see here a little diagram of an envelope. On the top, you'll see who, and you'll go all the way around clockwise: who, why, what, and where. So for the who, we're going to focus on who is the service user? What do we know about them? For the why is the service user presenting? What is the issue or problem? What work needs to be done to address the issue or problem? Where is the work happening? Which agency, workplace, or practice setting is it happening in? So for this exercise, we're going to use a case study to kind of flesh it out. So for this case study, we're talking about Ella. Ella uses she, her pronouns. So Ella is an 18-year-old woman. She is new to the province of Newfoundland and Labrador and also new to Canada. Ella is biracial and is currently isolated from her family. She does not yet have her high school diploma. However, Ella writes nonfiction. She is unemployed and living on low income. Ella is experiencing houselessness, poor mental health, accessibility issues due to her physical disability, and she also has no family doctor. As a result of these challenges, she presents at the not-for-profit shelter for young women in St. John's, Newfoundland and Labrador. So now we have another poll, and based on this information about Ella, I'm wondering, would you consider these layers of complexity with what's going on for Ella right now to be realistic compared with your practice experiences? So the answers are yes, this is pretty realistic for what I see day to day. No, this is not realistic. Mostly realistic, or it's too complex. So I'd be very interested to see what folks are seeing in their practice day to day and if this is similar to what you're seeing. So you can go ahead and give me an idea of kind of how realistic this is for you. And it may depend on your practice area, but in general, are the folks that you're serving dealing with the complexity of this nature? All right, so I'm happy to share. Well, it shows how hard you folks are working, but I'm happy to share that yes, this is mostly and fully reflecting the complexity of what folks are seeing. So hopefully, given the fact that this case study is now going to realistically reflect the complexity of what folks are seeing and how hard folks are working, that this will be helpful for you in identifying theory and reflecting on some of that. All right, so let's get started with the exercise. So you'll remember the envelope and the who was on top. So for Ella, we've outlined here that she is low income, she's 18 years old, isolated from family, she is a writer, she has a physical disability, she's a woman, she's biracial, and she's a newcomer to Canada. Next up is the why. So why is the service user presenting? In other words, what is the issue or problem? So here we see the family conflict. She's isolated from family. So as we know, there's typically reasons for that. Ella's currently houseless. She's experiencing poor mental health. Of course, there's a lot going on. She has some accessibility needs. She's not employed, and she has a limited education. So these are some of the issues that are presenting for Ella, some of the barriers that she's facing. Next up is the what. So as social workers, we would think about what work needs to be done to address the issue or problem. So first up, many of us would engage in assessment. We would also, if we're working at a shelter or if we're dealing with somebody who is experiencing houselessness, one of the first things we do is try to get that basic need met and send off a housing referral. We would also likely be mapping some of her strengths. We would want to build trust, and this is an important intervention, especially when working with anyone, but especially for folks facing a lot of barriers and folks who may have experienced some mistrust in systems and have ended up in this situation. We would probably refer or engage in mental health counseling if Ella was experiencing poor mental health. We might refer to the occupational therapist for some accessibility needs to be met. We might send off a physical health referral or connect her with the family doctor. And then there's a question mark next to education or employment, because depending on where we work and what we're focusing on, there may of course be some, basic needs that must be met before we send off an education or employment referral, but it's there because a lot of us do it all. So where is the work happening? And we've kind of built everything in together here. So the work is happening in St. John's, Newfoundland and Labrador, at a voluntary shelter service for young women. And it's happening at a nonprofit community service provider. So obviously this is going to impact the type of work that we're able to do and that we're expected to do. So you can see it all comes together here in terms of what we've connected with Ella. So how are we going to identify which theories and models? I'm sure all of this is very familiar to everyone. So when you think about, these things are pretty common. A lot of these terms are familiar. A lot of this work is familiar. It's what folks are doing daily. It's where folks are working. So utilizing this exercise helps inform your work, and it helps draw out the work that you're already doing. You can use it to help weed out what is most important for the person you're working with and what is possible within the agency. So let's tease out and identify some of these words that have now appeared in red. So as you can see, these are just examples, and In part, this is because we can't possibly fit everything into this little envelope with my messy writing. But the other reason is because it's just a sample. And for you, you'll be able to recreate this exercise with anyone you work with, just to help you or to help students draw out some of the theories, models, and methods that you're using. So in this example, Ella is living on low income. This might be a situation where you are using a Marxist theory to understand why Ella is experiencing this. So there's not a lot of money coming in. She's finding it difficult to support herself. And you might use a Marxist lens to look at this. So you might look at the inequality in society, see that Ella is, an individual who does not hold a lot of capital or a lot of access to production. So this might be a situation where you use Marxist theory. Could also be a situation where you use functionalism. And perhaps, according to this theory, there's a reason for that inequality in society. Ella has a physical disability. So in this case, you may use critical disability studies. And under this, you may use a social model of disability. You may use a medical model of disability. You may think, from a perspective of the medical model, you may think that there's something wrong that needs to be fixed. Or from a social model, you may think that Ella needs barriers reduced in her life and that society is creating these barriers. You see there that she's isolated from family, and this is where some of the more traditional social science theories may come in. So you may think about attachment theory. How has this impacted Ella and her relationships with family? Ella is also a writer. So you might think about empowerment theory. How can Ella's writing help with her feelings of empowerment? You may, she writes nonfiction. So does this mean that she writes about herself? Does she write about the world? Does she write about things that are true for her and her social construction of the world around her? Ella is biracial. So what we know is that Ella presents as a racialized person, and so this impacts the way she moves through the world. So we may use critical race theory to understand some of the barriers that she's experiencing. She's a newcomer to Canada. As we know, Canada is a colonial country, and so we may use an anti-colonial theory to understand some of the barriers that Ella has faced or is facing. Ella is only 18 years old, so according to the law, she is an adult. But as we know, a lot of the 18-year-olds that we work with, they're still finding their identity development. And some of those child development theories could come in handy when we're trying to understand Ella and where she is on her journey. Ella is a woman, uses she, her pronouns. And so we may use feminist theory to understand some of the experiences Ella has had, how she's feeling, what she sees in the world. She may be facing barriers because she's a woman. So next, let's move on to the who and then the what. So the what is the issues or the concerns that Ella has. So Ella is currently houseless. And again, for this, you could use an example such as conflict theory. So that inequality is fueling what's going on for Ella. You may think about family systems. So thinking about your BSW education and the families course that you did, you might think about family conflict and family systems. And that might inform some of your work with Ella. Ella has no family doctor, so she's having trouble accessing some of the systems in society. She's also a newcomer to Canada, so that could impact that. So when we think about the systems theory, the ecological systems theory, how everything works together, we think about Ella and how she may be experiencing some disconnect with that. When we think about poor mental health, so a lot of us may come at this from the perspective that Ella might need some mental health counseling if she has poor mental health. But for now, we're trying to understand, where is this poor mental health coming from? And so as social workers seeing the person in the environment, we understand that Ella is going through a lot at this moment. She's facing a lot of barriers. However, some of us may use a more critical lens and may think about using mad studies and thinking that, it makes sense that Ella would feel unwell in a situation like this. And that even if some of Ella's basic needs are met, if she still feels, we don't know what's going on for her specifically with her mental health right now. She could be hearing voices. She could be experiencing a reality that's different than the reality that you experience as her service provider. And so, depending on how you view what's going on with Ella's mental health, this is going to inform your work with her. In terms of her accessibility needs, again, you could think about the social model of disability. So, is it that there's something wrong with Ella, or is it that Ella has not had her needs met in a society that's capable of doing so? Ella has no employment and low education. So some folks might use motivational theory to understand this. They might say, well, is there a reason why she didn't try to achieve these goalposts in life? Do we need to work on her motivation? So these are just some examples. And now we're going to talk about the who, what, and the why and the where. So for the interventions that you're going to think about using with Ella, you're going to think about the assessment. So this is where we get into our tools and our models and our methods. So we're using an assessment, which could look like a care plan, a support plan. It could look like a RIE assessment. It could look like a various plethora of different types of assessments, depending on what model or tool or method you choose or you are expected to use. You would, of course, be using interviewing skills here. And then next up, you would think about her basic needs and what you're going to be able to try to help her meet. So first of all, we think about housing. And I'd like to point out, in case folks don't know, that Maslow's hierarchy is actually derived from Indigenous knowledge. It's from a framework called the Blackfoot Nation framework. I encourage you to look that up later. So we're thinking about her needs and how her basic needs are not met and how we can begin to intervene here. Part of that is building trust with her as well. And that could be a skill that some of us have developed in many different ways, depending on who we're working with. We would think about counseling, of course. If someone's experiencing poor mental health, we'd want to connect them with supports. And so you might think perhaps solution-focused is most appropriate, or perhaps that's the only service that you have access to refer her to at the time, depending on where you are. Right now we're in St. John, so there are some options for her. But in terms of what's out there, there's a lot of solution-focused models. So we might refer her for this, or we could use narrative therapy, maybe because Ella is a writer and maybe because of the choices that we make, we think narrative therapy would be really effective and helpful. As for education or employment, we might use goal setting. Once we meet some of those basic needs, depending on what your working relationship or what the timeline looks like when you're working with Ella, you might think about referring to education or employment if that's in line with her goals. Maybe it's not. Then you'd have to go back to the drawing board. You would, of course, want to map strengths with Ella. So a lot of us will focus on strengths, and that's using, our strengths-based identifying skills, mapping strengths, taking stock. And of course, all throughout this, we'd be using systems navigation. And in the middle, you see there the harm reduction clinic. So that's just something that I know about in community, that folks without family doctors who are facing a lot of barriers, they're often referred there or accompanied there with their service provider. And it's a place where Ella might be able to access some really low barrier medical services, which could be helpful considering the level of barriers that she's facing. Next up, we're going to talk about the where. So where are we operating from, which agency? And as we know, Ella has presented at a voluntary shelter service for young women. There's opportunities here for crisis intervention, of course. She may be presenting in crisis. This may be an opportunity to utilize harm reduction. Harm reduction is a very commonly used approach and tool in a lot of community nonprofit centers, but as well as in a lot of shelter services. It's becoming more and more popular for folks. And so you'd also be using a lot of system or eco mapping to look at which systems Ella needs access to and how they're connected and how you can help make those connections. As we know, Ella is also a newcomer to Canada. We don't know how long she's been in Canada or if St. John's is her first stop in Canada, but we'd be using a cultural humility approach, perhaps, if we want to make sure that we're learning from Ella what is most helpful for her. How can we approach this in a way that we can learn more to support her? How can we approach this in a way that says, I don't know everything and I would like to know how to best support you. And of course, we are coming at this from a nonprofit community service provider setting. So this may be an opportunity to be person-centered depending on the agency that you work for. So as you can see, this is a lot of different options, and we wouldn't be using all of these at once. You wouldn't have the time. Not everything fits well together and complements each other. So you would need to tease out what's most helpful. But the purpose of this exercise is to help you see that in your day-to-day work, when you're dealing with serving a person who has all of these things going on, that you are using theories and models daily. And this is a great and easy way to kind of tease it out. So just to summarize and go a little bit beyond identifying, as you can see here, I've circled the who and the why reflect our understanding of the person and what they're facing. Why are they presenting? So that constitutes our theoretical understanding. As we said, theories are a way that we understand. And so the where and the what, which is circled in blue here, identifies and cover our case planning and interventions, which is often based on where we are working. So this brings me to highlight the question, what can we learn from this exercise aside from identifying theories or models? So I'll ask you to reflect for a moment on why you use the theories and models and methods that you use. Based on the poll results, most people appear to use a blended approach, which is excellent. It shows that folks are curious to try some traditional social science theories that can be really helpful, especially when we're looking at a young person and their development, and also using some critical theories, which really helps us bring in that structural approach, or beyond that, perhaps a postmodern approach, to understand layers of power and inequity, which is inherent in our work as social workers. So I'd like to know which approach folks like to use the most, and I encourage you to stick it in the group chat if you feel comfortable. And so Siobhan McLean always says that the stamp on this envelope is your approach. So I think that's a really nice visual way to remember that no matter what theory or model you're using, you do always get to put your own approach on it. And so I'm curious to know which approach you prefer and why, or do you use a blended approach? Some examples might be a person-centered approach. I've heard a lot of folks tend to use that. They really like that. It means that you're taking the approach of centering the person's wants and needs, their identity, their social location. Thinking critically about that is really important. You could be using a narrative approach. You could be centering the story of this person as they tell it. Some would say that's also person-centered. So it is a blended approach for sure. A lot of folks use a strengths-based approach, and that's centering the strengths of the person. So regardless of if you're making tough decisions in case planning, if you're struggling with getting this person access to resources, if this person is struggling with a lot of barriers, you will always center the strengths of the person, even while you're dealing with the challenges that are going on in your service provision. So now that you've thought about your preferred approach, I'm wondering if it aligns with your experience of practice. Is it easy or challenging to align your approach with the work that must be done? Are there ethical barriers or dilemmas within your agency that you're experiencing? If your approach is person-centered, are there ways you can incorporate theories which complement it? So if you're working, for example, with a single mom and she is experiencing a lot of barriers, would it be helpful to use a feminist approach? As we clue up, I encourage folks to think about incorporating some new theoretical groundings. And I know folks sometimes barely have time for a break, let alone some extra learning. But I think it's amazing that so many folks have tuned in today and have prioritized their own learning and building on their own strengths and skills. So I wonder if we could take some extra time, and having students is a great time to prioritize this learning. How we understand something, so which theories we're using to understand something, can significantly influence what we choose to do about it. And while we may experience some limitations in what we can do, it can help us to think more outside the box, which we're already great at doing, but it can just build upon the skill even further. So I said we'd come back to talk about some of Siobhan's resources, so I'm happy to give you an opportunity to learn more here. So Siobhan's YouTube channel, which was booming during the COVID lockdowns, allowed an accessible way for practitioners in the UK to collaborate. It's a great platform, and it was a great platform for disabled practitioners to share their practice experience and knowledge in an accessible and safe way on YouTube during COVID, when, and COVID is still with us. So I note the use here of identity first language. You've probably heard me say disabled practitioners, disabled individuals. And it can be personal, but in terms of what I'm seeing in literature and critical disability studies, identity first language seems to be important to a lot of folks. So Siobhan's YouTube videos have featured many practitioners, especially those who identify as neurodivergent. And for those of you who voted for, when we sent out the poll of trying to determine which topic we'd cover in this continuing education session, for those of you who are interested in supporting disabled students, or maybe you yourself as a disabled practitioner, it can be really helpful to broaden some knowledge and to tune into some of these YouTube videos that Siobhan has developed and collaborated on with other practitioners throughout the UK. And here you'll also see the little icon here. I took a little screenshot and cropped it. So this is what the app looks like when you go into the App Store to look around. It's called Your Critical Friend. You can recreate the envelope exercise. There are social work theory exercises, resources, and information. I'd really encourage you to check it out. It's a great tool to have. It's on your phone. Your phone's always with you anyway. So in this day and age, it can be very helpful to have that in your back pocket. Just my references. And now, before we open up the floor for questions, I want to thank you for your time. Tried to keep things running smoothly today, as I'm sure everyone has things to get back to, but I really appreciate you tuning in today. I want you to know that although it's amazing to be here on the first day of Social Work Month with you and to acknowledge that we should celebrate Social Work Month, I also hope that you take time to rest and to recharge, whatever that looks like for you. Social workers are some of the hardest working professionals in our province, in our country, in our communities, and we didn't choose this profession. A lot of us, this profession chose us, and there's reasons why we stay day in and day out doing what we do. So you are so valued and so appreciated. And here's just a little photo of a bookmark that I made, and it says, "Be gentle with yourself because you're doing your best." So thank you so much.
That was great. Thank you so much, Nikki, for this excellent presentation. The envelope exercise is certainly something that everyone can take away and start using in our own practices, but certainly in our work with students as well. So that was fabulous. Thank you.
Thank you.
So we have arrived at our Q&A. So there's lots of time to get questions in. Just want to start. Someone had a comment there that the envelope approach was really a great approach, and then having the different pen colors as well, in terms of having things highlighted in red, was really really helpful.
Great.
And people really thought the information and the approach was excellent. So I just want to start with that,
Thank you.
that comment. So one of the questions we do have is, of course, in our work as field instructors with students, how do we support students who might struggle with or even have a dislike of theory and not really understanding, the importance of theory? How do we support students?
Yeah, that's a good question. I know I've supported some students as a field instructor who've said, I hate theory. I just don't like it. I know it's important, but I don't like using it, or I'm not sure, I don't fully understand. And to be honest, when I was a BSW student, I struggled too. And I think up until Lindsay introduced me to some of these resources, I still had trouble quickly identifying or differentiating. So I think that that visual exercise that we used with that silhouette can really help to start the students thinking around what theory actually is. And it's how we understand a phenomenon. Which, if you ask a student, so if you're seeing, for example, a young person who's isolated from their family. So say, you're supporting a student working with youth. You might ask, okay, so how do you understand that? How do you make sense of what's going on with this young person? And based on what what the student says, you can then say, okay, so how you understand it aligns with this theory. And that can sometimes set off the light bulb to say, oh, I was using it and I didn't even know. And that can help build that confidence. And just using some of the tools and resources available can be a great way to help introduce it. And if they're still resistant, it may take time for them to start using theories and models intentionally. But it's part of the learning process for everyone involved.
That's great. Thank you, Nikki. And someone sent in some commentary that, which certainly speaks to what you were saying, that this is a very helpful approach to use with BSW students so they can understand the importance of theory that guides our work. And that most times, we may not understand that theory guides our way of being, but we are informed by theory and don't name it. So that importance of naming it being so important. So
Mhm.
I just wanted to share that comment that came in as well. So keep your comments and questions coming. That they're great. Another question that we had come in, someone is saying they don't get any time to really think about incorporating theory. So that kind of comes from that comment as well. And what are some things that that can be done to kind of start incorporating and thinking about theory more?
Yeah, that's a great question. As I mentioned in the presentation, I know everyone is super busy and feeling the crunch probably now more than ever. So, with that in mind, I mean, there are many organizations that should and can prioritize peer consultation amongst social workers. So if that's something that you do have access to or that you can suggest, that could be a great arena for discussions around theories and models. Another idea might be for when you're looking at your continuing education credits as your renewal comes up, you can seek out specifically some materials on theory. If that's really important to you, you can kind of park that in your mind up until next year and try to kind of seek those out. That could be a helpful way. And then another suggestion I have is, for folks who like to read, you can always in your spare time, if you find it relaxing. If you don't, you don't. But if it's something that you like doing, I'd encourage it. And then, for those of you who are you might be furthering your education already, working on your MSW degrees, I'd encourage you to, you know, try something new in terms of incorporating a different theory or talking to some instructors or professors about that. And it can really expand your thinking. I mean, throughout my time in the MSW program, something that I learned a lot more about was critical disability studies and MAD studies. And that's what I'm using to help inform my pathway project. So expanding some of your thinking around that, and then it can really open up doors for more of your interests as well and help you feel more prepared to support all kinds of folks in the field.
Mhm. Excellent. Thank you so much, Nikki. Just want to share a comment that someone had in the group chat, how they really like the analogy of the envelope in understanding the connection between theory and practice. And over the years and their experience as a field instructor, they've an analogy they've used to help students to see theory and practice is to help students see their theory and practice as a performance on stage, where the theories we use are the backdrop for the stage, and the models, methods, and tools we use are part of the dance. So, just thought that was an
Wow,
interesting analogy as well. Yeah.
that's awesome.
We did have a question around the app, the name of the app again. Someone just wants that repeated. If you can do that.
Yeah, so when you look at it, once you've downloaded it, it's called Your Critical Friend. But then when it's on my home screen, it's called Social Theory. So I would encourage you, there's a copy of the slides in the resource tab. I would encourage you to just have a look at that little icon, and that can help you if you search either Your Critical Friend or Social Theory. It should come up, but regardless, that little icon should help you identify which is the right one. Another way to find it would be to go on Siobhan McLean's website, just Google her, and you'll find access to the app through there.
Excellent. We did have another question, and again, comments that the envelope approach was new to them, and they really liked it. Felt it was inclusive, easy to recall and apply, in practice. Um, and the person's just curious to know which theory is the one you would use the most, or that you do use the most, and why. Recognizing, of course, that that's depending on the who, what, when, who, what, why, right? So, is there one that particularly do you find that you use
Thank you
more?
so much for asking. So for me, I think when I finished my BSW degree, all the students in the class got awards, and mine was most feminist. So I will definitely go ahead and say that's a big one for me. But as I've kind of grown in my personal and professional identity, and pursuing social justice as a core value for myself personally and professionally, I've learned that just feminist theory in itself is not enough, and that we need to be thinking about the economic plight of the people that we work with. So I use a lot of Marxist theory. I use a lot of critical disability and MAD studies. The field of critical drug studies is becoming more and more popular. So I've worked with a lot of people who use drugs, and that's one of the ones that I use the most, for sure. Thank you for asking.
Hmm, that's excellent. Thank you so much. We have a question around, supervision. I know you've talked about, this tool, this, method, the envelope exercise in terms of working with students and reflecting on your own practice. Where do you think it might fit with supervision? And
Mm. Yeah, from the perspective of the supervised or the supervisor?
I think both. Yeah.
Yeah, good question. So I would encourage folks to keep their supervisors on their toes and ask, how are you understanding this? Which theory is informing your work? And if there's differences in how you're understanding the situation, you could probably use theory as a tool to help you communicate better in terms of your understanding of the issue versus their understanding of the issue, if there's a difference. And for supervisors, I would encourage you to try to make time with the folks that are under your supervision, to help them build their competency, because leadership, again, similar to the reciprocal nature of learning between students and field instructors, I do think that you can learn a lot from the folks you are supervising. I know when I was in a supervising role, I don't think any of my leadership skills would have developed if I wasn't challenged. So I do think that's a huge part of it.
Okay, excellent. Thank you so much. The next question, is more people do their education at different times and different theories are taught in different programs. And this question is around person finds the use of critical theories a bit overwhelming because they're unfamiliar. Do you have any suggestions, when that happens, when some of those theories are unfamiliar?
Yeah, absolutely. So I remember being, a brand new, bright eyed BSW student, and there were folks in my class who were a bit older than me coming back to school to do their BSW. They had more life experience, they had more exposure to things in life. They just seemed like they were more seasoned in this world. And I was so envious of the things they knew and the questions they could ask. And I was so shy and reserved. And so, something that I've learned is that if you don't challenge yourself and put yourself out there to try new things and learn new things, then you might stay stuck in feeling that way. So I'd encourage you to try new things. And it sounds really simple, but I'll just give you an example. Um, for a long time, a lot of the learning I was doing around feminism was based around white feminism because I was caring about what pertained to me or the people that I loved and knew from growing up. So I started to attend film screenings and go to events and go to some social action events where I learned about issues that didn't directly affect me, but still were so interconnected with issues of social justice. And so again, that takes time, resources, commitments, and a lot of folks have families and jobs, maybe second jobs, and they're busy. But at home, you can try watching something new on your streaming services. Go on YouTube and look up a documentary. Something that's interesting to you. Doesn't have to be boring to you, but just try it, give it a shot. And if it piques your curiosity, it could be a great opportunity to further that learning.
Hey, that's excellent suggestions. Thank you so much, Nikki. I'm just scanning down through. I don't see any other questions coming in, but we'll certainly loop back in a few minutes if there are any. But I just wondered, Nikki, if there's any other comments from the questions that you felt might be that you wanted to just have put out there as you consider the questions that have come in, but also the content of the presentation.
Yeah, I guess I'm struck by the comment about theory being the backdrop for our performance, and I think in a funny way, it's connecting social work with arts and expression is really important. I think that some of what we put forward and how we understand the world can be very reflective of who we are and what we believe. And so, yeah, I would just encourage folks to reflect when they have time, and it might be a good chance to do it during this month, to think about what's important to you and what barriers are you coming up against in your work, and to think critically about that. So, what is it that, what are the roots of these problems? And rather than putting band aids on some of these problems, what can we do together as a community? Because no one person can fix the issues that we see, but we work together to do that. So, just keeping up that work. So, thank you so much for all those questions and comments. I really appreciate it.
That was a great reflection, Nikki. Thank you. We did have another question come in, and you briefly just mentioned it. I know it wasn't the focus of your presentation, but if you would be able to speak briefly around identity in first language and when it's most appropriate to use it versus person first language, which has been, the best practice.
Yeah, absolutely. And I'm speaking on this from an able-bodied and neurotypical perspective. So I just want to put that out there first, that I'm not an expert in any way. But I have worked with a lot of folks and learned from a lot of folks who use that critical disability perspective, which kind of brings into focus that if you live as a disabled person, that's part of your identity, and it's important, and it doesn't take away from who you are and what you're able to do. It just part of what makes you you. So I think for some people, that identity first language is important for that reason. It's still very personal, and a lot of people still use the person first language, people with disabilities. And so there's no one rule. It's all individual. As we know, we work with the people in their specific environment. So it's never inappropriate to ask, what language, if you haven't had an opportunity to hear the person say it, to ask, what language do you prefer, and to practice it. It's the same as practicing pronouns. I think folks sometimes struggle, especially if it's someone that who, may have told you that they have a different pronoun than they did before. But practicing is the easiest way to get into the habit of using it and respecting that person's not preferred pronoun, but just their pronoun.
Mm-hmm. Yep. Excellent. Thank you so much. And someone made a comment in the question around and destigmatizing words like disabled. It's not inherently a bad thing, and it's not a bad word.
Absolutely. Thank you so much. That's awesome.
Okay, well, I don't see any other questions that have come in there. So you've answered a lot of questions, Nikki. So thank you for answering those questions. That's so engaging when we can have that conversation. So I'm just gonna have one more look there. No, I'm not seeing any other questions. So I think we can wrap things up if that's good with on your side too.
Yeah, absolutely. Thank you so much for the questions and comments. And Annette, you're an excellent moderator. Thank you.
Oh, thank you, Nikki. I follow your lead on this as the presenter, so thank you for being such a great presenter. But I do want to, take an opportunity to thank you, Nikki, for facilitating this excellent webinar for us today. We had so many registrations, so social workers across the province were certainly interested around this topic. So thank you so much for doing this for us today and for sharing your knowledge, expertise, and experiences with us. And regardless of, one's area of practice, a reflection on the use of theories and models in practice is so important, as you've talked about, Nikki, throughout the presentation. And we hope that this webinar sparked your interest as participants in learning more about the theories and models that guide our social work practices. So thank you, Nikki, for taking time from your busy schedule. You've been quite busy over the last little while doing your MSW, working, and your continued learning. But thank you for taking that time from your busy schedule to facilitate this very informative session for us today. It is truly appreciated.
Thank you,
Uh,
Michael.
yeah. And I just want to note that RSWs attending can claim one required CPE credit for attending this webinar as per the NLCSW CPE policy. And as Nikki noted at the beginning, the PDF of the presentation is available in the resource section of the platform, along with those great resources that Nikki mentioned. So you can hop on over to the resource section and, print off or download those resources as well. As you do begin to sign off, we do ask that you complete the evaluation form that should appear on your screen, and because your participant feedback is always so greatly appreciated. And I want to just say thanks again, Nikki. Thanks everyone for joining. We hope you enjoy the rest of your day and all of the Social Work Month events and activities. And Nikki, I'll leave the last word to you.
Just thank you again for tuning in. I know everyone has, again, busy schedules, and remember to take time to rest and recharge this month. Thank you for what you do and who you are.
Amazing. Thank you so much, everyone. And thanks, Nikki. Have a great day, everyone. Bye.